According to the American Cancer Society, 1 in 8 women in the U.S. will develop breast cancer in their lifetime. With October, Breast Cancer Awareness Month, quickly approaching, I wanted to take the time to explain to you what breast cancer exactly is, the risk factors, genetics, prevention criteria, and the good news for those who are in that 1 in 8 category. I am an oncology RN, and since 2008, my newest job title has been Breast Health Nurse Navigator. My practice has been focused specifically on breast cancer patients. I educate them about their disease process, treatment options available, emotional and financial issues that the patient and family faces when a diagnosis of cancer has entered their lives, and survivorship for their new normal. According to the American Cancer Society, breast cancer is the most common form of cancer for women, and the second leading cause of death, second to lung. 1 in 8 women will be affected. Take a look around this room. This is a scary statistic. So, what exactly is breast cancer? Well, what breast cancer is a group of malignant cells that originates in the breast, the ducts, lobules, or the tissue itself. It can invade the surrounding tissues and are spread, which means metastasis. Men can get breast cancer too, equal opportunity disease. The American Cancer Society estimates that breast cancer in men in the United States for the year 2013, that there will be 2,240 new cases of breast cancer. About 410 men will die of the disease, and breast cancer is 100 times less common among men. The lifetime risk of men getting breast cancer is about 1 in 1,000. The prognosis or outlook for men who get breast cancer was thought to be worse. Usually it was because of lack of knowledge or lack of awareness. But if caught early and treated, the cure is possible and at the same rate as women. Cancer grows when a cell's DNA is damaged or mutated. We are still unsure how these cells get damaged or mutated, but it could be genetic or environmental, and in most cases it's probably both. But most patients will never exactly really know what caused their breast cancer. But these are certain risk factors that are associated with breast cancer. Some can be changed, some can't. Here are the risk factors that you cannot change. Gender. Simply being a woman is a risk factor. Women are 100 times more common to get breast cancer than men. Probably because men have less circulating female hormones of the estrogen and progesterone. Number 2, aging. The risk increases as we age. 2 of 3 invasive cancers are found in women 55 and older. Number 3, family history of breast cancer. The risk is higher among women who have blood relatives who have the disease. And also 4, personal history of breast cancer. Is cancer in one breast increases the risk of developing a new cancer in the other breast or in the same breast again. Race and ethnicity. White women are slightly more likely to develop breast cancer than are African American women. African American women are more likely to die of the disease, though, because of economics and cultural issues. However, in women under 45 years of age, breast cancer is more common in African American women. Asian, Hispanic, and Native American women have a lower risk of developing and dying from breast cancer. And those of Ashkenazi Jewish descent tend to have a higher incidence of breast cancer, probably due to the prevalence of BRCA1 and 2 genetic mutations. And I will go into that later too. The other one is dense breast tissue. Dense breasts are made up of more glandular and fibrous tissue and less fatty tissue. Women with dense breasts have a higher risk of breast cancer than women who have less dense breasts. And unfortunately, dense breast tissue can also make mammograms less accurate. A number of factors affect breast density, which would be age, menopausal status, menopausal hormone therapy, pregnancy, and genetics. Then menstrual periods. Women who start menstruating before age 12 or went through menopause after age 55 have a higher risk of breast cancer, thought to be due to the more circulating hormones, estrogen and progesterone. Previous chest radiation. Children or young adults who have had whole chest radiation have a tendency to have a higher risk, and those are usually your lymphomas, non-Hodgkin's, things like that. Only 5 to 10% of breast cancers are thought to be hereditary, meaning that they result directly from an inherited gene mutation, and I will go into that further later. Lifestyle-related factors, and these are changeable. Having children. Women who don't have children or have children after the age of 30 have a higher risk of having breast cancer. Having many pregnancies and becoming pregnant at a young age, though, reduces breast cancer, again, possibly because lack of menstruation and therefore less circulating exposure to those hormones. Birth control increases due to that long-term exposure to those hormones. Hormone therapy post-menopause, or HRT, hormonal replacement therapy, is controversial, and most people increase their risk, and it's related to the increase of hormones.
I'm enjoying this so much.
Breastfeeding. Still being studied, but it has the ability to lower risk for breast cancer because it's interrupting the menstrual cycle, therefore decreasing exposure to those hormones. Alcohol. Risk increases when the amount of alcohol consumed increases. Consistently, this is a controversial area in study, and it's frequently changing due to theories in school of thought. Overweight. Fat produces estrogen. A large percent of breast cancers are fed by estrogen, therefore feeding a possible malignancy. Physical activity lowers risks, and that goes without saying, everybody needs physical activity. Now, these ones are unclear. Environment. I firmly believe that things in our air and our soil and our food have something to do with the development of cancer. Studies are constantly going. We don't know, there is no exact correlation yet. Vitamin D, lack of sun exposure. What I find interesting is in the areas where there's the least amount of sun exposure, Alaska, Washington, and Canada, there's a very high incidence of breast cancer. And most of our patients do have a decreased vitamin D circulating in their blood. But now, I want to go into genetics a bit more in depth. These are genetic risk factors. Certain genetic changes, which are mutations in genes, such as the BRCA1 and 2, can increase your risk for breast cancer. This is determined through a genetic test. If you have a family history, your chances of getting breast or ovarian cancer will be passed on to your children. Genetic risk factors. Certain genetic changes, mutations in certain genes, such as BRCA1 and 2, can increase your risk for breast cancer. This is determined through a genetic test. If you have a family history of breast and ovarian cancers, these gene mutations can be passed on to your children. According to the National Cancer Institute, BRCA1 and 2 are types of tumor-suppressing genes. I'm sure you're all aware of Angelina Jolie's controversial announcement this year because she was positive for BRCA1 and 2, the two types of breast cancer susceptibility genes. She decided to have bilateral mastectomies, and she will also be undergoing a hysterectomy soon in the future. The BRCA1 and 2 genes, the chance of them developing breast or ovarian cancer in their lifetime goes up to 87%. Per Myriad Genetics, they're the ones who developed the test to screen for this mutation. Now, I'm sure this was a very difficult choice for her to make, but she watched her mother suffer and eventually die at age 56 from this disease. And her maternal aunt also died from the disease shortly after Angelina announced her surgery and her experience. She chose the only way she knew possible to protect her children from having to go through what she did. And I quote, this is what she wrote to the New York Times. "I chose not to keep my story private because there are many women who do not know that they may be living under the shadow of cancer. It is my hope that they, too, will be able to get gene tested and that if they have high risk, they will know that they have strong options. Life comes with many challenges. The ones should not scare us are the ones that we can take on and can take control of. I hope this will be helpful to other women." And Angelina Jolie. How do we screen or prevent breast cancer? First of all, prevention. Doctors are still unsure as to how to truly prevent the disease. So the biggest and most important piece of information that I can give you is know your specific risks and follow screening guidelines or criteria. I prefer the American Cancer Society recommendations for screening, and this is their recommendation. The goal of screening exams for early breast cancer detection is to find cancers before they start to cause symptoms. Screening refers to the tests and exams used to find the disease, such as cancer, in people who do not have any symptoms. Early detection means using an approach that lets the breast cancer get diagnosed earlier than otherwise might have occurred. Yearly mammograms are recommended starting at age 40. But if you do have a family history, we ask you to start at 35, and then if you stay asymptomatic or without symptoms, then you can start again at 40. Clinical breast exam, usually every 2 to 3 years for women in their 20s and 30s, and then every year after age 40. Women should know how their breasts normally look and feel and report any difficulties or changes to their healthcare provider. Breast self-exam is a controversial part of screening, and some doctors are having issues with it because they say that we are causing fear in the younger population. So it's just good to know how you feel and what's going on. Some women, because of their family history or genetic tendency to certain other factors, should be screened with an MRI or an additional test with their mammograms. Discuss this history with your doctor, and then you guys can make the decision. Now, we know what to look for. Knowledge is power. No more doom and gloom. Early detection means breast cancer can be found early. If it stays in your breast, it won't kill you. If the disease goes on and metastasizes to other parts of your body, we can make it manageable. It can be like a chronic disease. The treatments have changed significantly for those who are facing the disease today. We now have many new promising options. These newer therapies are more tailored to specific disease types, and they're designed to minimize the side effects. Number one is targeted therapies. Herceptin is one. We use these for patients whose tumors express the HER2/neu gene, which makes the tumor more aggressive. This, accompanied by chemotherapy, can suppress this gene, and therefore it'll stop secreting the HER2, and it will cease tumor growth. Now, and also we are now able to test each patient's breast cancer and personalize their treatments. This test is the Oncotype DX test. It looks at 21 genes on the patient's cancer, and it will help decide if their cancer will be helped by chemotherapy, radiation, or no treatment at all. Chemoprevention is a specific group of drugs taken in pill form by people who either have developed the disease or are high risk. Those are usually tamoxifen or an aromatase inhibitor, and what it does is it shuts off the circulating estrogen and progesterone, therefore it won't feed those tumors. Radiation treatments now are very pinpoint, very precise, and that way we can spare the tissues and organs around the area that's getting radiated. And then oncoplastic surgical procedures or breast-conserving surgery. Procedures often performed during initial surgery to preserve the shape, look, and symmetry. These are usually your lumpectomies, your nipple-sparing mastectomies, and they end up looking quite nice. This is just the beginning. There is so much more on the horizon for treatment and prevention of this disease. All in all, this is progress worth celebrating. Okay, let's recap. I discussed what breast cancer is, the risk factors, genetics, screening and prevention criteria, and the good news. So, I think we can say the earlier the diagnosis is made, the better chance there is for a cure. So, for those 1 in 8 women who get breast cancer sometime in their lifetime, there is good news. We are finding them early through screening, education, medical and technological advancements, and we are identifying those at risk and assisting them in reducing their chances of getting breast cancer. Remember, knowledge is power. The most important thing we can do for ourselves and our families is spread the word. October is Breast Cancer Awareness Month. Acknowledge those who are fighting, honor those who lost their fight, and wear that pink ribbon.